There are a mountain of things to do to start your own company, but if you see them as small hills and just keep tackling each small hill, you actually get there. If you look back from where you were, even to me, a month ago, a year ago, the growth is amazing, but it's by the daily diligence of putting it into the business.
Hi, everybody. Welcome to Medical Entrepreneur Podcast. We're so glad to have you here. We're here with a very special guest, Mary Beran of New Leaf Aesthetics. And she's an amazing medical entrepreneur, has accomplished very much in her career. And we're so excited to have her here. Mary, welcome to the podcast.
Hi, Adam. Thanks for having me on.
Oh, it's my pleasure. You've had such an interesting journey from, basically into, being, obviously a medical professional and then doing your own businesses. Could you tell us a little bit more about, what got you into medicine initially?
I've always been a caregiver from young, and I, in college, was actually pre-med, and at the same time, I was a nursing assistant in the hospitals, and I just liked the relationship that I got with the patients. So I actually switched from pre-med to nursing and finished that in '86.
And then what, so you like the relationship with the patients, is that what kind of drove you into doing more like nursing? And then can you tell us what drove you to become eventually a CRNA?
So while I was in nursing school at age 21, I got my tonsils out, and they rolled me into the operating room, and they thought that they put me to sleep, but I could hear them say, "Okay, you can start." And it was just a moment of sheer terror. I couldn't move, I couldn't speak, but I remember them saying that. And then, of course, I went to sleep and they did the surgery. But I just wanted to stop others from having that moment of terror. So I went into anesthesia.
So altruistic, and that's very scary. That's a very scary position to be in, I can only imagine. Could you tell us a little bit more about, after you became a CRNA, kind of some of your journey beyond that?
So I was a CRNA. I've been a CRNA for years. And in 2002, I specialized in ophthalmic anesthesia. So I've been doing retrobulbar blocks for over 20 years. In 2015, I started my first company in anesthesia, and that's where I've been since.
And so what was your first company in anesthesia?
It's called Mary E. Hall, CRNA, PLOC.
And is you basically having your own business where you do anesthesia and you don't have to report to a boss because you're the one who does the anesthesia?
Absolutely. And then my billing company bills the patient's insurance.
Wow. There's probably so many people that are just interested to hear that they could still practice their same field they trained in, but actually be their own boss, not have to deal with a hospital administrator or nursing administrator. What made you make the transition from being in the hospital or in the hospital system to having your own your own business?
So I really enjoyed the idea of owning my own business and being my own boss and really having my own time and being able to say yes or no. I wanted to work that day.
I totally feel you on that one, because that's what I felt as soon as I got, even when I was in training, I felt like there were so many people that didn't know about anything that we were doing, especially in the field of anesthesia, but yet they were in charge of our decisions.
Right.
And I remember when I first got out my first contract, there was a nurse administrator who it was very much like a very political kind of like power dynamic going on between these different nurse administrators and hospital administrators, and it was just like one of these like political wars kind of thing. Mm-hmm. And there was a lady who was put in charge of all the ICUs and the PACU, and I just remember like this person was making decisions. And they had no formal training in any of this. They weren't really aware of how it worked, and yet they were making policies that affected patients, and it affected all the providers and also all the patients. And many times they didn't even know what they were doing. And that's when I first said, like, there's got to be a better way. Sounds like you might have had the same
Exactly.
the same thing as well.
Yes.
Since you had your own anesthesia company, you've also have branched out yet again and turned over a new leaf, if you can forgive the pun. And you have your very own medical spa called New Leaf Aesthetics. Is that correct?
Yes, I do.
Awesome. Can you tell us a little bit more about your journey into aesthetics and what made you interested in aesthetics to begin with?
I, at 57 at the time, walked in and I just said, do whatever you want to do to me to make me look younger. And after a couple hours, my husband came to pick me up. And when he looked at me, I looked at him, we both just started crying tears of joy. The transformation was incredible.
And so once you felt that, like you wanted to give the same feeling to others.
Absolutely. As many people as I can.
And so do you feel that, so often aesthetics is kind of looked at as, in mainstream media and these kind of things is like vanity or, like unnecessary, that kind of thing. What's your experience with aesthetics for somebody like you, because you do it every day? Like, what's your experience of aesthetics and what do you feel it is?
Well, Adam, I was so used to taking all of the pictures so that I wouldn't be in them before I had this transformation. And then I felt so good about myself, then I wanted to be in the pictures. And I meet so many ladies who feel the same way. And I want them to have the confidence to be in the pictures.
That's very, very beautiful. I love that. And was there ever a time where, maybe you could give us an example of some of the transformations that you've done at New Leaf Aesthetics?
Oh, absolutely. Even just a month ago, I had a patient come in and she was even melancholy about how beautiful her daughter was about to go to prom. And I started teaching her about the aging process in the face. And I showed her some pictures that I have of the daughter and the mother and what happens to your face and why. And right then and there, she said, "Can you fix me?" And I said, "Well, she was beautiful." So I just took her beauty and enhanced it. And she sent me picture after picture, day after day. "This is what I look like today. This is what I look like today." And she was excited.
And then, what would you say to somebody who is maybe working in the hospital system? They might feel kind of repressed, by the administration, levels of administration, these kind of things, and they're thinking about becoming a medical entrepreneur. What would you tell them in your words?
I would tell them to 100% do it. It gives you freedom not only in your schedule, but again, in your artistry. And really, it's freedom through prosperity.
That's beautiful. And then, could you also talk about the fact that aesthetics is a little different than most fields of medicine in the sense that like you described earlier, where it's kind of this strange marriage between art and science. Can you maybe discuss a little bit more of that?
Well, that's the part that's really exciting to me because I can take my own artistry and my own vision of someone and their face, and I can deliver results that make them look more youthful. So the combination of medicine, obviously, the first thing we do in New Leaf Aesthetics is we care about safety, and then about delivering results that are natural but transformative.
And then could you also maybe talk about a little about your philosophy of aesthetics? Because I know that a lot of people, when they're first interested in coming to a med spa, that they're very afraid that they're going to have some kind of, unnatural look. Obviously, you're focused on being natural. Could you maybe talk about your philosophy on how you are able to channel what somebody has and make it into something that's, they enjoy?
Yeah, I think the first thing that I do in a consult is to point out the patient's natural beauty. And sometimes they don't even see that in themselves. Then we enhance that beauty.
Wow, that sounds like a good process for sure. And then, where is your New Leaf Aesthetics located? If someone is interested in finding you or talking to you.
I actually have two locations. My mainstay place is in McKinney, Texas, about 20 miles north of Dallas. And the other is in a town called Wiley, which is same, it's just more east than McKinney.
And then, Mary, what would you tell somebody who is maybe they're a CRNA or maybe they're a nurse practitioner, maybe even just an RN, and they feel like you do about aesthetics? They feel like it's an interesting field. Would you tell what would you tell them that may be interested in aesthetics but haven't done anything yet about it?
I would get first a good attorney, a good accountant, and probably the most important thing is to become trained really well.
Like a lot of people go through life and many times they're very shy or they have something like maybe they had acne as a young person and now they have scars on their face but they didn't really know what else is out there. If you're somebody who's dealing with something like that and it bothers you, like what would you recommend that they do first?
Oh, come see me. Because truly, I think what's underestimated is the way that your face ages by your skin health or lack thereof. And there are so many things that we can do. We offer RF microneedling, we offer chemical peels, we offer a skincare line. Really can transform your skin to make it better.
Could you also talk a little bit more about your approach to skin health and using various modalities to kind of maybe anti-age or keeping your skin healthy like you described?
Sure. I like to hit it from all different angles. Again, with chemical peels for hyperpigmentation, resurfacing with microneedling and RF microneedling, to increase your collagen and elastin and get that elasticity back in your skin. So we decrease the pigment, we increase the elasticity. It's amazing.
That is awesome. And just out of curiosity, now that you've done everything and you've done like almost every job in medicine, you started out as an RN, then you became a CRNA, now you're doing aesthetics. So you have this huge, field of experience. How do you find the different practices, and which one do you like the most, personally?
I don't want to get in trouble. I definitely am the most excited about aesthetics because that it transforms lives right in front of me. Although I have to say, the thing I love about doing cataract anesthesia is that you change someone's life in an hour as well. We've had some patients in anesthesia that have been in nursing homes, and once they regain their vision, they've gotten out of a nursing home. So they're
Wow.
both pretty impactful.
Sounds like you're impacting lives on both ends. That's awesome. And then for anyone who basically, might be interested in having their own, business, or, getting started up, any advice you'd have to somebody who, is stepping out? How would they know that they're an entrepreneur at heart, like yourself?
I think you have to feel comfortable being uncomfortable. And there are a mountain of things to do to start your own company. But if you see them as small hills and just keep tackling each small hill, you actually get there. If you look back from where you were, so even to me, a month ago, a year ago, the growth is amazing, but it's by the daily diligence of putting it into the business.
Well, that's a really good lesson. And so do you feel that the way that you perceive challenges or problems affects your ability to solve them?
Absolutely.
That makes a lot of sense, because oftentimes, I would see people that say, "Oh, this is so difficult, so difficult," and then it seems like it's so difficult for them, whereas other people might not have as much difficulty with the same problem.
Right. But everything's difficult until you know how to do it, right? You have to start somewhere, and you have to be comfortable starting from square one.
Maybe some people are interested in aesthetics, but they don't know if it's right for them. Could you maybe talk about like a day in your life? Like, what happens when you're in your med spa? Like, what does it look like practically?
The first thing I do is say a little prayer for the Lord to be in my hands that day. And then I prepare for my patients to come. When someone comes in for a consultation, we sit and we talk about where they've been, where they'd like to go as far as their aesthetics journey. I'm big on education. I want my patients to understand what's happening, what I'm going to be doing, how it's going to feel. And I really coach them along the process. I'm wide open for when they have questions, and I do a lot of educational videos. I just like when people understand what they're doing. And I think one of the most important things, if you're going to find aesthetic treatments, know who you're going to, research them, make sure that they've been educated, make sure that you kind of see eye to eye with you, interview people.
And do you feel that there's certain, like, for example, there's certain aesthetic providers that might match, like, personality wise? Is that more of important than skill wise, or?
Well, I think they're both important. You have to feel comfortable with the person that's just injecting your face, and taking your face into their hands, basically. It's a huge trust issue, and you should have that trust.
Absolutely. How do you feel for most, medical entrepreneurs that are going out there? Like, do you feel that education is really kind of like very important for them to do?
I think it's one of the most important things.
And do you feel like basically kind of taking the difficult science concepts and breaking them down into smaller pieces? Is that kind of what you're doing when you say you're educating people, or can you give some more
Absolutely.
examples?
When you go to school for this, you have so many different terms and the terminology, and to break that down into the normal layperson who may be a banker or a teacher, and have them understand what's happening and what you're going to do. I think that's wonderful.
And then for somebody who's interested in going to aesthetics, would you say that, what could they expect in terms of, I guess, like, kind of a lifestyle? Because I know a lot of people eventually go into aesthetics because they want to escape being on call and these kind of things.
Well, the first year that I had this company, it was truly 24/7 working on the business. So it's not something that a loafer can do. You need to be diligent, and you need to be persistent, and you need to overcome. And if it were easy, everyone would be doing it.
But then once you build it up, is there certain expectations that you can have in terms of, like, do you, I mean, imagine you're probably not on call for New Leaf Aesthetics?
Oh, no. Well, my patients can always reach out to my company for sure. But no, there is no call. And I'm able to be flexible with my scheduling. It has really given me a nice life work balance. And I have time now to play my piano, and I have time now to ride our tandem bike with my husband. It's a wonderful balance.
And for those people that are interested in, for example, maintaining a more youthful appearance or doing anti-aging, obviously that seems like a big area that people are focusing on now as the population ages. Do you feel like that's a market where someone who is in a medical entrepreneur could get involved and help people? And do you feel like that's has like good value for them?
Oh, absolutely. It's only growing and growing every year by leaps and bounds. So the opportunities are out there.
Mary, I understand that you also, not only in doing aesthetics such as Botox, filler, and PRP microneedling, you also have other medical devices and newer technology that you have access to that you know you're using for your patients. Is that correct?
Yes. Here at New Leaf Aesthetics, we have a device named Venus Versa, and it's an RF microneedling device, which is radio frequency. So instead of the traditional microneedling, it enters an element of heat to it so that you get skin tightening and skin resurfacing.
And could you give an example of maybe a patient that has had a treatment from that, like kind of what they could expect or who you might use that device on?
Really, anyone is a candidate to have this RF microneedling. It will help with any kind of acne scarring, fine lines and wrinkles. It increases your skin elasticity and makes your pore size smaller. It's a whole host of skin health.
And so, do you often find that people come to you? Like, I guess, what do you think is your number one reason why people come to see you? Do you think it's because they're worried about fine lines and wrinkles, or is it more they're not happy with the way that their face is aging?
I think that most of my patients, because of my age, are 40 or above, and they are looking for anti aging. A lot of them with volume and skin laxity.
And you're a perfect example of how good you can look with aesthetics. So,
Thank you, Adam. You're too kind.
my pleasure. Uh, and so, I think it's. I mean, I think it's really true. You have to kind of live the life that you want to show your patients as well. So. And so if someone was interested in, for example, say they're, in their 50s and they look in the mirror, and what I've heard from a lot of people, and I don't know if you've heard this as well, is that people will often say, like, I look in the mirror and I don't recognize the person staring back at me.
Absolutely. I was there too.
And what would you say to someone who has that feeling? Like, what would you recommend that they do? Or how do you
I
recommend?
just first want them to know that there is hope. There are treatments that we can do to make you feel 5, 10 years younger, and not just look wise, but feel. Once you look like you're younger, it gives that extra bounce in your step where you feel like you're younger again.
Mary, one of the things that we saw over here with our medical spa was that I see a lot of people that are what I would call like, sales professionals, like realtors, salespeople, and they often will come because they find, well, with treatment that they often will have increased confidence, and then that will actually lead to better numbers for them. Have you found the same thing?
I have found the same thing. Realtors are a great example, Adam, where you're being judged. Like it or not, in this day and age, you're being judged. And unfortunately, men and women are judged differently. And women are expected, especially in fields like real estate, to be youthful.
And then could you give an example of some of the patients that seek out your services that reach out to you?
So I have a lot of 50, 60, 70-year-olds who have just lost the volume in their face and the elasticity in their face. And I think what they should know is there are a lot of modalities that we have that can help increase collagen, increase elastin, help with the elasticity of your skin. We fill the volume in your face to get those curves back again.
And then Mary, could you tell us more kind of about your journey into basically kind of growing your med spa and even like obviously you had to learn new skill sets, like you had to build, like, for example, behind you your entire med spa, the whole design and everything. How did you find the whole process, and do you find that like part of your entrepreneurial journey is like learning new skill sets?
Yes. So this design was a friend of mine's. I can't take credit for that. But I think the important thing when you start a business is I always say I live as if I'm broke. I take profit first. I don't have any excess. I call it money on the shelf. I am very mindful about where I spend my money. And to me, it's not how much you bring in, it's how much you have at the end of the day.
Hey, Mary, if someone wants to reach out to you, what's the best way for someone so they can reach out to you?
My company is New Leaf Aesthetics. You can always call or text me at 469-436-5441 or visit my website at www.newleafestheticstx.com.
Well, Mary, that's perfect. Thank you so much for coming on the Medical Entrepreneur Podcast. I really appreciate it. And we're so honored to have you as a guest.
Thank you so much, Adam. It's great to talk to you.
Great talking to you.